Welcome to Elevate. I'm Rachel, and this is Nikki.
Hi, Rachel.
We're here to bring you the best insights from local wellness experts, helping you elevate your health, one simple step at a time.
Don't forget to sign up for our newsletter for curated wellness tips. You can watch this episode on YouTube or Spotify, or listen on Apple Podcast at Elevate Wellness.
On this episode of Elevate,
aspartame also has shown to cause cancer. It still increases your insulin levels, so you still can get obese from that, even though it's 0 calorie. My dad, when I was actually in medical school, my dad told me, I swear to God, son, every time I drink a diet product, my blood sugar goes up. I'm like, there's no way. You're not doing it properly. You're not taking it accurately. It's gone up from something else. Now there's been studies that show that aspartame increases your risk it increases your insulin levels, which predisposes to diabetes, even though it's not considered a calorie because the body can't break it down. It's only considered a calorie if the body can break it down.
We're so excited to welcome Dr. Almog Gal of Unity Health to the Elevate podcast, a board-certified internal medicine specialist with more than a decade of experience. Dr. Gal is passionate about uncovering the root causes of persistent health challenges and providing highly personalized care. In this enlightening conversation, he shares the critical role of functional medicine in addressing health issues tied to toxins and hormonal imbalances. Dr. Gal discusses the impact of environmental toxins, the importance of hormone optimization, and how lifestyle changes like intermittent fasting can transform health. He also highlights the rising challenges of obesity and autoimmune diseases, stressing the need for education and awareness in the community. We believe you will walk away with practical tips for healthier living, including a return to natural eating habits and the powerful role of self-love in achieving lasting well-being.
welcome to Elevate, Dr. Gal. We are so excited to have you. And before we jump into
And I'm so excited to be here. Thank you very much for having me.
Yes.
Yes, of course. Before we jump into all the things from hormone health to weight loss, we have some amazing topics and discussion ahead of us. Can we start by having you share with us your story and what inspired you to focus on functional medicine to get to the root cause of the health conditions that you were seeing your patients struggle with?
Yes, very good question. It started when our life expectancy in the States has started to go down. It's still going down year by year. I think this is the 4th year straight. And we were the first Western nation that was happening to, like the first developed nation that was happening to. So I started doing research on things they don't educate us about, and it's mainly toxins that we're bombarded with all day, every day, that these toxins are called endocrine disrupting compounds. And so they disrupt the endocrine system, and there's ample amount of evidence. This information has been out there for over 20 years, but yet mainstream has not caught up with it, and it's wreaking havoc. It's causing thyroid issues that are subtle that you can't detect on testing. It's causing obesity. Mayo Clinic coined the term obesogen because there's linked to that. The more processed the food is, the more of these chemicals and compounds they have. And so one major red flag that's very alarming is fatty liver. And back like 30 years ago, 40 years ago, we used to call it cryptogenic cirrhosis. Cryptogenic means unknown, and cirrhosis is an end stage of liver disease. Excuse me. So it used to be very rare. It was like number 8 or number 9, ninth cause of liver failure. Fast forward to today, guess what spot it is?
Number 1.
Number 1. And it's frightening because we're even having little children being diagnosed with this. And I had patients tell me, Dr. Gal, I swear to God, no matter what I do, I'll lose 5 pounds, I'll starve myself, and then I'll gain it right back. And so regarding mainstream, when I first started practicing, you just didn't believe your patient. You would just say, yeah, they overeat, they don't eat properly, they don't know what they're eating. But that couldn't be further away from the truth. That is a possibility. But if you look at the obesity levels back in the 70s, we had access to food as well all the time. We used to eat about the same amount that we eat today, But yet obesity, diabetes, hypertension was significantly less. And so what's accounting for that? And it's again, these toxins. Another big thing that accounts for it is hormones. And so these toxins block our hormones, and our hormones actually decline with age, both men and women. And there's a lot of new peptide hormones. We're finding out GLP-1s, for instance, which there's a company called Ozempic that took GLP-1 and changed the molecule a little bit. So that's kind of where I really understood where medicine is today. And so Ozempic had to do a study to get FDA approved. And these studies cost hundreds of millions of dollars to do randomized placebo-controlled trials. And so only with these studies can you get an FDA approval. And the FDA did approve it, and it's a miracle drug. It's a wonderful drug. We're researching it now. We know it decreases heart attack and stroke in people that have already had a heart attack and stroke, that have diabetes. We're looking at it now. If it prevents heart attack and stroke in people that don't have diabetes or heart disease, it's getting approved shortly for chronic kidney disease. And so it helps overall. And again, one of the biggest ways that it does that is by decreasing our appetite, slowing our gastrointestinal motility. So we get fuller faster and we stay fuller longer. It also blocks two peptide hormones in the brain. One of them is responsible for hunger. It blocks it by about 50%. That's ghrelin. And then the other one is peptide hormone Y, which is specific for carbs. So it will also knock out carb craving. And because of that, a lot of people actually cut down on their alcohol intake significantly, because it was really a carb craving that they had that was a major component of their drinking habits. And so basically, this medication is still very expensive because it's patented. And so my question is, if we use GLP-1, glucagon-like peptide 1, and don't change it like they did in Ozempic, it's a natural form, will that have the same effect? And so that's where functional medicine comes in. We like to do everything as natural as possible. And I am having tremendous success with where it's in its purest form. Tirzepatide is GLP-1 plus GIP. It's another peptide hormone together. And so we also have the regular peptide hormones, and they're working really well. But I can't say that it's approved for obesity because no one did those studies that cost $100, $200 million, because they're your own body's chemicals and you can't patent them. And so now I understand why mainstream medicine is going towards synthetic. And now a lot of physicians are branching off, mainstream physicians, and going towards natural. And so when you understand it from that perspective, it really helps with integrating these into your practice. Now, don't get me wrong, we still need mainstream medicines and they work well in certain circumstances. But if we could treat a lot of ailments naturally, why not? And so let me also go back to the toxins. I want to make sure your audience at least hear it with which ones are the most significant. And one of the most significant is phthalates. And it's in plastic, the plastic bottles, the coating. They actually put them in personalized care products. And the other big one is BPA. And BPA is a resin that you find around every can. So people are asking me, hey, Dr. Gall, I'm drinking very low calorie soda. What do you think? I'm like, it depends. If you drink it out of a glass bottle, it's perfectly fine. But if you're drinking it out of this BPA, then you're going to run into the issues. And BPA is directly spermicidal, meaning it kills sperm on contact. And they did a pretty large study ever since the 70s. The sperm count in the United States and other developed nations has dropped by 50%. And that's why now when you deal with infertility, the first thing you do is you check the male sperm count. And so, it's a big problem. Atrazine turned male tadpoles. It reverted them back into female tadpoles. And that's because it blocks testosterone. And now in our children, they just did a recent study. They see the distance from the anus to the testicles continues to shrink. And again, that's because male's testosterone is being blocked even in utero. So these chemicals easily diffuse through the placenta. The first study that was done regarding specifically the thyroid, I actually did an international conference about this issue, about this topic, and will lower your T3 and your T4. If that's the case, your body is supposed to immediately increase the levels because those are very tightly regulated. The thyroid is the most important hormone. Every single cell uses thyroid. That's not true for all the other hormones. And so it's supposed to increase your thyroid levels immediately, but it doesn't. And if it was one study, I really wouldn't put much weight behind it. But since then, there's been dozens of studies that have shown this to be the case. And so the Europeans are very advanced when it comes to this. I think they've banned plastic straws, plastic utensils, because they know the repercussions that these chemicals are having on us.
That's fascinating. That's unbelievable how all of our environmental toxins are really wreaking havoc on our systems. You talked about decades ago, mainstream health was just not taking this into consideration, and it's taking so long to catch up. I've listened to Dr. Mark Hyman for years, and he really has led the way in changing this way of thinking. Why is it that it is taking us so long to start recognizing the obvious? I mean, my answer would be money and big pharma, but I'd like to hear your thoughts on that, because if we don't keep having these conversations, change won't happen. It is changing, but it's slow, as you just talked about. Speak to that.
So when I was first studying these toxins, they're actually also this is very important for people in the grand strand to understand. It's also in our sunscreen products, and they do block your hormones. It's avobenzene, I'm going to butcher the name, but it's all those weird, funky names. There's like 4 different ones that they use in sunscreen products. The FDA has known for more than 7 years now that they're leading to cancer, that they're causing cancer. The Australians, because they're exposed so much to the sun, did significant research on these products. And what they've come up with was zinc and titanium based sunscreen products. Those are usually not in a sprayable form. Again, they have to add chemicals in there to make it to where it's aerosolized, but it's also the thick cream that you put on. So it creates a good barrier. And some people have a zinc deficiency and it diffuses through your body. It could even help you if you have a zinc deficiency. And so that's a simple fix that the FDA could have done years ago, but they haven't. And so I'm a big fan of Robert F. Kennedy Jr. He is doing great work. And again, he's rattling the cages because he's passionate about it, because he cares about our children. He cares about the future of humanity. And it's going to be a long, hard road. But the first thing we have to do is to be aware of these things. And so I don't think anybody has brought as much awareness to the public as much as him, because he has the biggest megaphone, And so we are starting to head in that direction, but it's more of a grassroots efforts instead of mainstream, because who's going to pay for those commercials that talk about these toxins?
Right.
Commercials cost a lot of money, especially when it's on the news. Who's going to pay for that? So then the awareness needs to come from a grassroots effort.
Hi, friends. Without our sponsors, we wouldn't be able to bring you Elevate, your local resource for connecting with our local wellness experts. Plus, our sponsors are offering amazing offers to our listeners. If you've been interested about the science and healing power of red light therapy, this is your sign to try it for yourself. At Laser Lab, they specialize in helping your body do what it's designed to do: heal, store, and recover naturally using the power of light. Whether you're dealing with chronic pain, slow recovery, inflammation, or just low energy, this therapy helps you feel better from the inside out. And right now, for our podcast listeners only, Laser Lab is offering an exclusive Experience the Light consultation. Your first session is free when you mention Elevate or use the code PODLIGHT at booking. It's your chance to see what red light therapy can do for your recovery, your energy, and your health. Go to our show notes and book your visit today at laserlab.com/podcast, or stop by Laser Lab and tell them you heard about them from Elevate. Yeah. Makes sense. Wow.
Well, there's just so much to unpack here. But like you said, awareness is where it starts. And I think that beyond awareness is the acceptance that the things that we put on our body and the things that we are ingesting and the toxins in our environment are real and they're there and they're causing health issues that are starting in our children drinking out of aluminum cans. So much is a hormone disruptor. What those things mean, because I know that there's individuals and adults that just have kind of thrown their hands up in the air, or it's such an inconvenience. All of a sudden, it feels like overnight, the way that they lived and they ate in the 70s and the 80s is so they can no longer maintain that now because things are so, our environment is toxic. It's an overwhelming change for them. So at the very least, it's wait a minute, but our children. And if we don't change these things, we already have evidence of what it's doing. When you mention infertility rates, our hormones are all out of whack. The things that it is leading to, autoimmune, chronic conditions. And if our vessels are not healthy, we simply put, we cannot go out, live life in abundance, and serve others the way that we are intended to be here to serve others.
This literature is in the endocrinologist journals. They've done a wonderful job bringing awareness to what they do. But because, again, nobody has done studies to see, well, if we try to counteract that with this or with that, can it help? So because there's no studies that have been published showing that, they can't give you recommendations for guidelines. So they know it's a problem. They say it's a problem, but they don't have guidelines on how to fix that problem. It's mainly trying to stay away from these chemicals and detoxifying. And I know you have a lot of wonderful viewers that know all about toxicity and how to detoxify. But detoxification is mainly the 3 Ps: peeing, pooping, and perspiration. So that's how we get rid of these toxins. So you drink more water, you try to have 1 to 2 bowel movements a day that's soft. Sauna is great for perspiring, but they don't talk about the main one, which is the number one cause, and that's our visceral fat. That's the fat around our organs. The toxins stay there because they're fat soluble. They'll go and they'll get into your abdominal fat and they'll stay there. So the more visceral fat you have, the more toxic you are. It doesn't matter how much you do the 3 Ps. If you don't get rid of that, they're going to stay there. When you do your detox, yes, you're going to get some of these toxins out, but nowhere near the levels of where you remove that visceral fat.
How do we get rid of that?
Again, so the GLP-1s, the GIPs, I'm a really big fan because, again, I had those patients over and over and over again that I believe them. I cannot lose weight. I cannot, no matter what I do. And so it's helped significantly. It's not just that. Of course, the foundation is diet, exercise, and eating properly without these toxins. The next step then would be the GLP-1s, the GIP, which are, again, natural peptide hormones found in your body that decline with age. Just like male's testosterone decline with age, and male's testosterone is super important for optimized health. And so we know for a fact if you have low testosterone for a male, you're predisposed to diabetes, your cholesterol profile will go out of whack, high blood pressure, hypertension, inflammation, again, difficulty losing visceral fat, difficulty putting on muscle mass. And again, it's very, very important to optimize the hormones. And from my perspective, the 4 most essential things that the body needs is air, water, food, then hormone. And so it's that important to have your hormones optimized. And what's different between hormones and all other medications that are non-hormone based is that they work on only blocking a receptor or activating it. But hormones, and the reason why they're called hormones is because they will go into your genetic material, your genetics, and they will up and down regulate certain genes. So a really good example is low dose naltrexone. And taking low dose naltrexone, now you have to wait 3 months to see the full effects that it has because it's up and down regulating genes. Low dose naltrexone blocks, down regulates the kappa beta, NF kappa beta pathway gene expression. So it will lower it. And so you're really now, instead of taking ibuprofen or aspirin to lower inflammation, you're now going into the genetics itself and lowering where the inflammation came from in the first place. So it's
Root
literally
cause.
getting to the root cause. Exactly.
That's really interesting because inflammation is a big one too.
Absolutely.
So
Absolutely.
what I'm hearing is
Yes.
that,
So in functional medicine world, yes. No, I'm sorry.
well, so
No, it's
GLP-1
fine. I'll get back to that.
optimizes. So what I'm hearing is that GLP-1 is a natural occurring hormone in our body. Am I right? And that it
Glucagon like peptide 1. Yes, correct.
optimizes our hormones. So who would benefit? It sounds like more.
GLP-1 is a hormone.
Okay.
It is a peptide hormone. There's different classification. Most people know the steroid hormones: testosterone, estradiol, progesterone, cortisol, and all these are steroid hormones. They're synthesized from cholesterol. Cholesterol is the very beginning step. And then to get to each different one, you have certain enzymes that will change the chemical a little bit until you get to the testosterone, estradiol. For instance, the next step from testosterone is actually estradiol. And so that's why when you put males on testosterone, you increase estradiol levels, which is something that's very important to follow because it could cause too high of an estradiol level, can cause problems. And so GLP-1 is a peptide hormone that decreases with age. And so then our hunger stays the same as if when we were younger and our metabolism was faster. But now you're not able to control. You don't go down on your eating. And so again, for me, the biggest thing is to lose the visceral fat. And so many of your problems will go away. All the chronic diseases, obstructive sleep apnea, hypertension, diabetes, cholesterol, and many, many more. Cancer even.
I have a question.
Yes.
GLP-1s are now being looked at differently. We're seeing the shift. So many people were they're evil. Why would you take that? It's not the right way to lose weight. You're just going to go back and, put on the pounds again. But I listen to a lot of different medical professionals like yourself who are trying to share information with people now that using this peptide hormone, correct, is really what we've always had. It's how you administer it and to your patient that helps them. So am I on the right track with my thinking? And if so, can
Yes.
you elaborate on that?
Yes. Let me blow your mind a little bit.
Good.
Up until recently, there was no medications that can reverse diabetes. It would keep the hemoglobin A1C at bay, but the disease continued to progress. And the missing link to that was inflammation. And so these medications, Ozempic, tirzepatide, they will reverse your diabetes. They lower inflammation significantly. By 25%, your CRP goes down. That's, as some studies show, 40% even. And CRP is the number one marker of inflammation and mortality. And so because of that, some physical medicine and rehabilitation doctors, these are the ones that deal with the most complex pain syndromes, they'll actually use the GLP-1s for that specific reason, even if the patient is not obese or don't have diabetes. But then you're not going to be able to get it approved through insurance. It's very, very hard because, again, it doesn't have that FDA clearance for it. But we've known anecdotally and through studies that it significantly lowers your inflammation profile.
Yeah.
Quite remarkable.
And not taking that, what they call standard dose. You have to level it off for the patient, start them low and then work higher. And often cases, is that true?
Yes. And so the mainstream titration for Ozempic, you don't have really much of a choice. It's only 0.25 milligrams, 0.5, 1, and then I think there's a 1.5 and then a 2. So there's a big variation. And you really have to follow your patients closely because they'll end up getting constipated and they'll continue going up on that titration, and then their constipation is severe, and then they end up in the emergency room with severe abdominal pain due to GI dysmotility. And so that's when people will never go back on the drug again. And that's why when I start this medication on my patients, I follow them every month. It's very hard for a mainstream physician to do that because they're just so overwhelmed with patients. And I personally don't want to be on any medications myself, even if it's natural. And so what my patients do is through the protocols that we give them, and I've helped hundreds and hundreds of people. They will lose that weight. They will change their lifestyle. They will change their diet. It's like the point that helps you with your intermittent fasting. I'm a big intermittent fasting fan. And so that will give you that first push to be able to curb that hunger, to be able to then start intermittent fasting, change your lifestyle. Once you start eating healthy, the unhealthy foods don't taste good anymore. You crave healthy food. And again, it's blocking your carb craving as well. I would say about 60% of my patients, once they lose the desired weight, it doesn't come back. It might come back slowly, a pound to 5 pounds a year, but nowhere near the levels where they were just continuing putting on weight. And so they can come off of it. The 20% is going to have to do cycles like maybe 1 or 2 months out of the year. So they'll lose that weight initially, then they'll stop it for like a year. Then they gain that 10, 15 pounds again, do it for another month or two. And finally, about 20% need it lifelong. And we're starting to look at obesity also as, very complex, multifactorial. And it's not, oh, you're eating too much. No. And so a lot of people are predisposed genetically. And so they will need to be on these medications. I think about 20% of my patients that come to the weight loss clinic.
It's very interesting.
Dr. Gal, who would benefit from coming to see you? Because it sounds like everybody could come, knock on your door, sit down, speak with you, draw clarity on a lot of different health issues, and you could at least give them a few next steps moving forward to.
Exactly.
So do you see both men and women? What type of symptoms are people experiencing when they say, let me go see Dr. Gal? Share a little bit about that with us.
So knowledge is power. And again, we're not getting exposed to these things on mainstream media. And so literally everyone would benefit from at least one visit because I educate them on these things. I give them protocols to follow, to titrate. The people that will need to do more than one visit is those that have detoxed and they're still having the symptoms. And so at that point, it's mainly symptom based. So low libido, vaginal pain on intercourse, vaginal dryness, and then also now it's very important to realize because of a lot of doctors still are not aware with the most recent guidelines, which when I first started, they were saying don't use hormones. Hormones are horrible. They cause heart attack, stroke, blood clots, Alzheimer's. And so that study that was done, it's still to this day, it's the biggest study that was ever done on women's health. They used horse estrogen in that study, which is a totally different molecule. It's a foreign molecule to the body. There's 10 other foreign molecules in there, and synthetic progesterone. And so ever since then, hundreds, if not thousands of physicians have asked them to retract their study to correct it and state those as a fact. So you can't deduce that into bioidentical hormones. And that's the difference. Bioidentical is identical to your body. It gets synthesized, estrogen gets synthesized from yams. And so to differentiate and not say all hormones are horrible because they used a specific type. So you can't deduce that, especially if these hormones are foreign to the body. Let's say their study was actually accurate. There was between 30 to 50 significant events per 10,000. It doesn't sound like a lot, but it's enough to make us in the medical world very weary. Hey, I could cause 30 cases of heart attack or stroke, per 10,000. That's enough for us to say, no, we shouldn't use it. But if you take other data points and mix that in there, and so, for instance, osteoporotic fractures. In the elderly, a third will die of their fracture or a complication of it, like pneumonia, urinary tract infection while being hospitalized. A third will get back to mobility as usual. A third have some form of immobility issues. And so if you just take the deaths from the osteoporotic fractures, because even the horse estrogen still activates your estrogen receptors, it will actually increase bone mineral density.
Hi friends, have you heard about Ayurveda? It's the 5,000-year-old system of holistic medicine that brings your mind, body, and spirit into balance through personalized nutrition, herbal remedies, daily rituals, which I love, and gentle detox practices. Ayurveda helps you restore harmony and lasting vitality naturally. That just sounds good. We're so grateful for our local wellness expert and sponsor, Carrie from the Holistic Highway, a globally recognized leader in integrative medicine and Ayurveda. Carrie is transforming modern health by focusing on you, not just your symptoms. Through her personalized system that blends nutrition, lifestyle, and genetics, she's helping clients find lasting balance and vitality. The Holistic Highway provides a personalized system to manage chronic disorders by incorporating fundamental changes in diet, behavior, and stress while focusing on genetics. This individualized program is so successful that many of her clients have achieved maximum healing and vitality after years of chronic problems. Because there is no one size fits all in health, Elevate listeners enjoy a complimentary 30-minute consultation to discover your unique mind-body type and one actionable tip for better balance. So book through our show notes and mention Elevate to claim your offer.
Let's take a moment to thank one of our local wellness experts and proud sponsors of Elevate, Brain Performance Training. After more than 20 years as a registered nurse, Laurie Sampolo saw firsthand how addiction, anxiety, and PTSD affect families, including her own. Her hope and desire is to offer neurotherapy as a holistic approach to support people struggling with these and many other mental health symptoms. She's seen so many patients without the tools to manage their symptoms, but she's also witnessed countless lives change for the better through neurotherapy. At Brain Performance Training, the mission is simple: to remove the stigma around mental health so no one hesitates to reach out for help, whether it's from Laurie or another trusted professional, because healing starts when we reach out for support. Mention Elevate and receive 10% off a treatment package, which includes before and after EEG and 15 treatments. Contact Brain Performance Training at gmail.com or call 843-655-3325 to learn more.
So it will actually increase your bone mineral density. You know, the biphosphonates don't do that. Your osteoporosis projection is like this, is at this slope, but then you take a biphosphonate and now it's like this, but it still continues to decline, just not as fast. So estradiol and lifting weights for women, that's why I always say you need to lift weights. You don't have to lift bodybuilder weights, but when you put pressure on the bones and when you give it estradiol, those are signals for the bone to increase bone mineral density. And so if you take that data point, still, even if it was 30 to 50 deaths, the benefits outweigh the risks. But actually, luckily, because now there's been so many bioidentical hormone studies, which didn't exist 24 years ago now when that study first came out, it shows inconclusively that your heart attack, it shows conclusively that heart attack goes down, stroke, Alzheimer's, osteoporotic fractures. So there's a significant reduction in those. And now mainstream, both ACOG, American College of Gynecology, and NAMS, the North American Menopause Society, who give the guidelines for hormones, both of them have done a 180 now. And now they say, well, actually hormones are beneficial. It will help reduce osteoporotic, heart attack, stroke, et cetera, et cetera. They say to only use it in the 10-year window period. So up to 10 years from your last menstruation. But I still disagree with that, and I'll still do it past that. And so it's great that now mainstream has caught up and they have changed their guidelines. However, a lot of physicians are still unaware of that. And there's nurse practitioners also and PAs that just are not up to date with the most recent guidelines. But in the end, luckily, my mentor who I trained under, who was doing it for 40 years, he saw how beneficial it is. So he never stopped using them, and he still educated people like myself. And now again, it's caught up, and now we know it is beneficial, absolutely, for preventative medicine.
I think it's interesting that it's taken so long for that particular study to be shown the truth about it, because so many especially women, were left hanging all those years ago and could have had the help that they needed because, if I'm saying this correctly, a flawed study. It was flawed and was not true to the information being delivered to the public. So thank God the information is getting out now correctly so we can get the help that we need. I am on bioidentical hormones and it is a game changer. Even now, I've still had some people say to me, oh, you've got to be careful. Remember, it can do X, Y, and Z. I'm like, that's not true. So I find myself educating because I'm trying to be more educated myself and because more physicians like you are trying to make people understand the truth and the benefits of the hormones, the peptides and things like that so that we can have a more fulfilling life. I mean, there's nothing worse than feeling bad when you want to feel good. So
Yes.
thank God it's changing.
Yes, I agree. And I was only talking about the internal effects that you don't feel. And you're talking about the external effects, which is super, super important for a good quality of life, right? You want to have a libido, you want to have energy, you want to be able to put on muscle mass. And, that's the best way to do it other than eating properly and exercising. And so let me take breast cancer, for example. I keep doing a whole systemic review from all the different institutions. So like the National Institute of Health. So I keep researching. The last time was about a year ago, like a year, 8 months ago. Again, I reviewed all the literature specifically looking at bioidentical hormones. There's never been a study that conclusively shows that it increases breast cancer risk. Again, the caveat is that was 8 months ago. So there could be other studies that have since then. And in fact, women that had the BRCA gene mutation were put on a placebo and a control. So they already had the breast cancer. They had it removed. They underwent chemo. A group took placebo and a group took estradiol. The ones that took estradiol actually had lower breast cancer recurrence than the ones that didn't. And so that's a very important point. And also, if you think about it, when do we usually get breast cancer? In perimenopause or menopause. And so what happens is you lose your hormones, right? In menopause, you have no more hormones. That's usually when you'll get breast cancer. But the perimenopause period is super important too, because when you're perimenopausal, all the hot flashes, night sweats, this is due to excess estrogen. And so that's a dangerous period for women, is perimenopause. It's more dangerous than menopause. And that's because you have estradiol that is high, that goes unchecked, and low progesterone. And so you always want to have a specific estradiol to progesterone ratio. And so the estradiol will still remain high, and estradiol actually activates tissue proliferation. So in the breast and in the uterus, when you shed your uterus off, it grows back due to the estradiol. Progesterone stops that proliferation. It inhibits it. And so it's very important in the perimenopausal period, women usually need progesterone and progesterone only. And that counters the effect of excess estrogen.
This is fantastic. Everybody that's listening needs to share this with a friend or family member, their spouse. I'm really curious, Dr. Gal, we spoke outside of this conversation today about autoimmune. Do you see a correlation between autoimmune and our hormone imbalance? Is there a possibility that all these chronic autoimmune diseases and symptoms could be balanced with balancing our hormones as well? Because it causes so much inflammation. Is there a correlation there?
Yes, there is. And I can't say definitively. There might be studies looking at that specifically. If women are on hormones, will it prevent autoimmune diseases? I don't know that. But what I do know is estradiol is one of the most potent anti-inflammatories for women. And so autoimmune disease is inflammation. And so it definitely will help control symptoms, control autoimmune disease. And they did a study with women during COVID, and they found that women that were on hormones during COVID, and this again is from the endocrinology journals, had much less significant adverse reactions from the virus itself. So less death, less long COVID. They got over the illness quicker And again, when people die from COVID, it's due to the inflammation that the COVID causes. It just causes significant inflammation. It will white out your lungs because you have so much inflammation if you look at an x-ray. And so again, we know that they are significant contributors of lowering inflammation or of causing inflammation if they're low or not keeping it at check.
Dr. Gal, what I love about what I'm hearing from you is that you're doing the research. You're staying on top of everything that comes out. And that is such a valuable tool when patients come to you. They don't probably even realize all the things that you just shared with us, that you have the knowledge and that you are intentionally staying on top of the latest research, because things do change. I mean, that's just inevitable. So for you to be able to help your patients to the best of your ability and so that they receive the health care that they need to get back on the right track, you're doing all the work to make sure you have everything to bring to the table for them. I mean, that is just incredible. I suspect that does not happen everywhere. And I love the fact that we don't dismiss the traditional medicine. It, as you said earlier, has a place, but the functional medicine and bringing holistic ideas into a patient's care, you can't just dismiss one or the other. It has to be a combination. Would you agree?
Yes, absolutely. Without a doubt. Sometimes functional medicine is really well at preventative, and it will help chronic conditions. So it will help, if you lose your visceral fat, hypertension then doesn't become a problem, then heart attack, stroke risk, all these things go down significantly. But once you've already had heart failure or heart attack, now you need the mainstream medications because they have shown to reduce mortality and morbidity. And so there isn't any peptides that I know or hormones that will do it to such an extent that mainstream medicine does.
Dr. Gal, is there anything that you would like our community to hear specifically from you today that they can take away and implement in their day to elevate their health and their wellness journey?
Yes. The major thing is bringing this awareness, like Nicole said, to other people. And so it'll have a ripple effect. And we're so overwhelmed and bombarded with advertisements, commercials, our attention span has gone down significantly. When we sit here and we talk with passion, we talk to people we love and care about, it brings it in a whole different level. And so like fire, it's starting to spread. It is spreading. The awareness now compared to 5 years ago is significantly increased. But we have to continue bringing this awareness, and we have to get these poisonous food away from our kids. They have to change the lunch menu, which they're starting to, because for now they get ultra processed food. The more processed the food is, the worse it is for your health. And you want to look at the ingredients. And if it has more than 5 ingredients and you don't know the names of the other ingredients, safe to say you should probably stay away from those. And going back to eating like our grandparents ate. They ate meat that was butchered recently, that didn't have hormones pumped into it, or fish that were constantly treated with antibiotics. So try to go back to eating the way that our grandparents did.
How does someone do that may not necessarily have the means to do that? Give us some realistic tips and guidance to start changing the things that we do based on, maybe I don't have the finances. Let's make it realistic. Some people just can't afford the butchered meat that's that fresh, because unfortunately some of those things cost more. So what can all of us do that meets us where we are, whether our finances are big or small?
Actually, there's not much difference between buying regular eggs than buying eggs from a carton that you make. And so it's hard. Organic meat sometimes costs a little bit more. If you can't, it's no big deal. But then don't drink soda. Aspartame also has shown to cause cancer. It still increases your insulin levels, so you still can get obese from that, even though it's 0 calorie. My dad, when I was actually in medical school, my dad told me, I swear to God, son, every time I drink a diet product, my blood sugar goes up. I'm like, there's no way. You're not doing it properly. You're not taking it accurately. It's gone up from something else. Now there's been studies that show that aspartame increases your risk it increases your insulin levels, which predisposes to diabetes, even though it's not considered a calorie because the body can't break it down. It's only considered a calorie if the body can break it down. So again, If I want all of your viewers, if they want to take my advice, it would be look at the processed food, the ultra processed food as poison. It's better to stay away from them and intermittently fast, and then skipping a meal or 2 meals even and eating 1 meal a day. That's healthy. Once you fast, your stomach shrinks and you go into ketosis and you don't have an appetite. You don't want to eat. They actually found this out through the Holocaust survivors. There were skinny bones, and they tried to feed them, they wouldn't want to eat. So they forcefully fed them, and they actually caused what we call refeeding syndrome, which actually is a different topic. It's their body is so not used to eating that when they eat that amount, their insulin level spikes and potassium shifts, and it could be life threatening. But the point is that once you get to those states, and you eat properly, you really aren't as hungry and you can go fasting easily. And I always advise my patients to do a 3-day fast once or every year or two. You can't do that immediately. You're going to have to work up to that. But again, studies show it will regenerate your immune system because it will take the old immune system and burn it off and use it for fuel. And then your immune system is supposed to be regenerated. So we know that people that have fasted have much less autoimmune disease, cancer, heart attack, stroke, all those ailments.
And I would assume you do that under the of a doctor like yourself, because I think right now, if I were to try to fast for 3 days, I might end up passed out somewhere. I can't imagine, because when I skip a meal, I feel a difference. And I'm like, ooh, it's not good for me. So I'm assuming a 3-day fast is something that you make sure to do under the supervision of your doctor. Yeah. And also, I appreciate
any fasting, because some people might be on.
I appreciate those simple steps, though, towards making some swaps. Choose organic, choose the best quality. If you cannot afford, the butcher meat or the eggs, the organic eggs, look at what you're already doing and maybe removing the sodas and swapping it out for water. It is attainable. There are tiny shifts that we can make. So, and also the concept of fasting too.
And other simple steps to detoxify is drinking water from a tap water that's been really cleaned out. Although I don't advise that now in the Grand Strand, our water quality has significantly gone down. So you could get bottled water that's glass, those big glass bottled waters that from the spring. We don't use plastic anymore to keep our cookable materials. We use glass containers. Again, staying away from the sunscreen that has those toxins in there, and trying to cook with stainless steel or cast iron, because the Teflon coated materials, even though they say they call it many different names, those are carcinogenic. Those are forever chemicals. They're perfluorinated carbons, and so they stay with you forever. And in the studies that showed that they were safe, they kept it at a temperature that usually we don't cook in, because if you leave it on just a little bit high, it will get to 400 or 500 degrees, which is where they didn't study it. At those levels, these toxins start to break down and start to get into the food. The worst thing is when I go to Airbnb or, I stay somewhere else, they have the Teflon cooking material that has now had scars and scrapes on it. Once that happens, again, those chemicals are free to just get out of there. So it's very important. If you do have those, I advise against it. But if you do, at least use like a wooden spoon or something to cook the food with and serve it.
That's a good place to start too. If you're unable to modify the food that you are cooking, at least modify how you're cooking it.
And what you're cooking it on.
Absolutely.
Dr. Gal, how can our amazing Green Strand community get in touch with you?
Through our website, unityhealthmb.com. We also have Facebook, Instagram, Unity Health MB. And our phone number is 843-970-3996. And we've even added it to WhatsApp.
There's so much more we could talk about with you. So you'll have to come back, because you have a med spa, you have other things that are going on in your practice. So we can't get it all in.
Yeah.
You just spend all day with us, and we could even cover, half of it. So Thank you for all of the information that you've shared today. It's been so valuable, so enlightening. And, it is encouraging, though, to know that we can start to make some changes to get ourselves back on track, get rid of the sodas, drink more water, ditch the particular sunscreens, move in a different directions. I think that at the end of the day, we need to know that there is hope and that we can feel better and that there are options and that there are people listening like you that want to help us. So thank you for that. And thank you for being our guest and sharing what you shared today. You got to come back. There's more to talk about.
Thank you, Nicole and Rachel. It's been a great honor. And yes, please continue to do the good work that you're doing. And it does seem like an arduous task to undertake, but we're headed towards the right direction and just going to get easier and easier from here on out.
All right,
Thank
Rachel,
you so
your last
much.
question.
All right, Dr. Gal, what is the one small actionable step that you would employ us to do today to elevate our health and wellness journey?
Yourself. Okay, because that has significant repercussions when you don't. And it just, that's what improves your quality of life. That's what's going to help, people that just pick, you did an action, the action was wrong. You feel bad about it. It's good that we play it over again in our mind so that we know what to correct next time. But when we're sitting there like a broken record going over and over and over again, it creates negative thoughts, negative loops. I forget what the data is, but most of us have like 90% negative thoughts a day. And so that is very, very important. And I'm a firm believer that if you don't, it can cause cancer and all these other chronic diseases. So overall, that'd be really the most important thing.
Yourself.
That's powerful. Thank you so much.
Thank you, guys. Thank you very much.
Hi, friends. Please leave us a 5-star review and let us know what you thought of today's episode. Share it with someone who needs a little inspiration and tell them why they should tune in to Elevate, your go-to resource for healthy living here in the Green Strand.
Each week, we're cultivating conversations that inspire well-being, support the ebb and flow of coastal living, and help elevate our community's wellness journey.
Don't forget to join our newsletter, a culinary garden of resources, including our downloadable Wellness Made Simple with curated tips from our local wellness experts. You can click on the link in show notes to subscribe.
And of course, stay connected with us on YouTube at Elevate Health Grand Strand and on Instagram and Facebook. You'll find those links in the show notes. We hope you enjoyed today's episode. The information provided in the Elevate podcast and associated materials is for general informational purposes only and is not intended as medical advice. No content should be considered a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition or treatment. Reliance on any information provided by Elevate, its host, guest, or contributors is solely at your own risk. We encourage you to consult with a healthcare professional before making any significant changes to your diet, exercise, or wellness routine. Ultimately, your health and well-being are unique to you, and it's important to make informed decisions based on your individual needs.